are vacuum extractions by our practice. 85% of our patients who plan a vaginal birth go on to do it. So that is a very high statistic compared to, so what does that say? That says the other 15% are cesarean sections. Compare that to the national average of 25 to 30, and it's a pretty low rate here, which is a good thing. Thank you, Dr. Williams. Okay, so let's talk about C-section. What is it? It's the removal of your baby through an incision. Anesthetic is definitely needed. Typically, if you have a labor epidural and you require a cesarean, you have the epidural dosed to provide adequate analgesia. If you don't have an epidural or you're a scheduled section, there is a medicine that is delivered directly to the spinal region that sets up quite quickly and provides 2 hours of analgesia. It's an excellent form of dense block for a C-section. General anesthetic, where you go off to sleep, is a very rare occurrence. And I would say less than 1% of patients, even in crash situations, are delivered by general if we can avoid it. Second bullet point, in most cases we only have one support person allowed in the OR. It's not that we're being mean or cruel, it's that it has to do with sterile field and risks of infection to you. So usually the husband or significant other is present in the room, but other family members are not allowed. Total operating time, usually less than an hour. About 3 to 5 minutes to actually deliver your baby. The rest of the time is spent putting the layers all back together. So it's quite quick for delivery. What are our indications for a section? One, planned is your baby's in trouble. Your baby's not fitting through your pelvis, fetal pelvic disproportion, and that could be related to size of your baby, position of your baby, or size of your pelvis. And sometimes that's hard to distinguish until you're really in labor. There are other maternal and fetal indications that as they present, as labor evolves, would warrant an unplanned cesarean. Planned C-sections, someone who has had a prior section and elects not to labor, someone who has a breech presentation that's almost become the standard of care. We do not recommend that you consider laboring a breech. There are other fetal and maternal uterine conditions that would make a planned section a safer route for both you and your baby. After a C-section, there is a recovery period that is a little longer than your normal vaginal delivery postpartum. You have a catheter in place and an IV in place for the first night. That's removed the following morning. Pain relief you receive through an IV and with transition to oral medications in the morning. And the next morning, obviously, we get you up and move you around. Usually go home second or third day after delivery. We see you every day. When you have a vaginal delivery, typically you go home on the first or second day. For C-sections, usually third, I would say day 3 is the average for going home. And we put a set of discharge instructions on our website. Follow-up appointments. We see everybody 6 weeks after vaginal delivery. And we see our C-section patients 6 weeks after a cesarean birth, but we also see them in 2 weeks to make sure their incision's healing and they're feeling well. So in closing, our best advice is to be open-minded. I think patients who come with very set, rigid rules for themselves sometimes paint themselves into a corner and they end up being disappointed because labor and delivery is not as controlled as we would like it to be. And so being kind of open-minded about how things are going to go usually results in patients feeling really good about their delivery. Communication is key from both sides. We obviously want to hear what your concerns are, what you really find important to you, and ask appropriate questions, or ask any question that you feel you need to. And then also be flexible, and this applies to both of us. We want to make sure that you're safe. Our goal is to have you have a happy, healthy delivery, and to be and to take home a healthy child. Again, it's the whole idea of a birthing team approach. I think the nurses at Merida are excellent and also function very well with you during the whole labor process. Questions?